New flu numbers expected out by state health tomorrow, but safe to say it'll look pretty similar to the jump last Friday, which was for the week ending December 21st. That's the latest state report out.
That's right. Joining us now to discuss this trend, Upstate Global Health Director, Dr. Stephen Thomas. Dr. Thomas, you're in the studio. Thank you so much for joining us today.
Thank you. Thank you.
You know, this is the time we typically see flu numbers jump, but what stands out to you the most right now?
Yeah, so this uptick is a little bit later than the last two seasons. It's definitely going up. We don't know if we're at the peak or even close to the peak yet. We've seen a lot of infections in children, but also in adults. And flu is outpacing COVID for sure. So COVID's been kind of sort of at this low, stable level since the middle of November. But the winner right now might be RSV. Especially in children. I mean, Upstate alone is diagnosing hundreds of cases each week, and mostly in kids, but adults are starting to get infections as well.
Are we seeing more flu than ours? Is flu still our main concern, I guess?
Well, they're both concerning, yeah, because they're both concerning because flu can preferentially impact more severely older people and very young people, and RSV can do the same thing. So right now it's mostly young people with RSV. You know, we're not seeing a ton of hospitalizations with flu right now. COVID is starting to pick up a little bit, so it's a mixed bag, but overall it's been good news the last couple of times I've been here. It's no longer great news.
So I know you said it's hard to tell from the numbers kind of where we are, especially with the flu numbers. I'm guessing with the others too, as far as peaks. Last two seasons with flu, it seemed like we saw cases November, mid-December, where they were really spiking. You said it's later.
Yeah.
Does that tell us anything other than it's later?
I don't think it tells us really anything other than it is later. I mean, it's possible that because we've had unseasonably warm weather that we haven't had the indoor close contact gathering that we've had before. I don't think that it has anything to do with a different strain. The strains that they've isolated so far are, you know, the same as what we've seen in the past, and it's just, you know, anytime you take infectious diseases in human populations, it's really tough to predict.
Let's talk about the flu shot. There's still a lot of people out there probably haven't gotten it yet. Is it too late?
Yeah. Oh, absolutely not too late. Because again, what we're looking at is the curve is doing this. We have no idea what the peak is going to be. You know, once you get your annual flu shot, the immunity kicks in pretty quickly within a couple of weeks of getting that shot. And if we look at the numbers from last year, depending upon what population, anywhere from 30 to 50% reduction in needing to go to a doctor or ending up in a hospital. So you take 10 people with influenza, 5 of them who got vaccinated are not going to have to go to the doctor or might not end up in the hospital compared to the 5 who didn't. That's kind of how I think about it in terms of reducing risk.
You mentioned COVID and RSV already. As far as COVID, I mean, well, I guess both of them. I mean, predictably that we've had gatherings, we've had New Year's now, we've had Christmas, other parties probably leading up to that. That's probably a big driver of it.
Yeah, I mean, we know how it's transmitted, and so close contact is one of the major drivers of it. We've always kind of seen these bumps after these holidays, right? Thanksgiving, then we see a bump, and then the December holidays. So I expect in the next couple of weeks we're going to figure out what damage was done, if any. And it's been kind of a weird year. And if you look at, it's really kind of region specific. So the Midwest is experiencing a huge COVID outbreak right now, as well as the West. Northeast is a little bit later, which has been an interesting trend throughout this whole thing. So yeah, I would, if people have not strongly considered getting their seasonal COVID vaccine, I would really recommend considering getting that, especially if you're at high risk.
All right, other than getting the shot, you know, we have RSV, we have flu, we have COVID. These different viruses, are there different ways to protect yourself, or is the advice the same for all of the viruses? Yeah,
you could add norovirus in there, right, which causes really bad gastrointestinal problems and is very uncomfortable if you've ever had it. So if there's a vaccine available, strongly consider getting it, so we know for flu and we know for COVID, as well as RSV. And if wash your hands. It seems so simple, but really try to, every time you think about it, every time you walk, you know, by the sink, wash your hands real quick, soap and water, or they have those dispensers if you go to a public place. It really does a lot to reduce transmission because we're always touching our faces.
Sure.
You know, even though we don't know it, we are. And then if you're sick, stay home, don't go to work, get tested if you're at high risk, and call your doctor if you're positive.
Pretty simple stuff. Dr. Thomas, thanks very much for your time. We always appreciate it.
Thanks.
Thanks, Dr. Thomas.